As we go to get up and get more pizza to help yourself. This is not meant to be a formal time, but I'm really delighted to see so many of you here today. Thank you for being diligent in your RSVPs and Kathy chasing us all down with your emails. It was much appreciated. For those of you I haven't met yet, I'm John Mallinger. I'm one of the faculty in surgery and involved with this new CHOP, or Center for Human and Organizational Potential initiative that the school has undertaken. And I'm going to start by just asking Dr. Hingle to make a couple comments about that. Then I'm going to make a few comments about how a student focus on leadership development is part of what we want to accomplish and why we're here tonight. And then the bulk of our time, we're going to have the chance to chat with Dr. Kruse about his own leadership journey and learn from that. And then we'll talk a bit at the end about where we think this might be able to go as a student development exercise for us. So, Sue?
All right, so CHOP, the Center for Human and Organizational Potential, just got launched. It started out, it's been a work in progress for a few years now. We really were looking at things separately and then figured out how interrelated everything was. We were looking at professional development, we were looking at wellness, we were looking at them in medical students, we were looking at both of them in faculty. We quickly learned that many of the concerns that students and faculty have related to well-being and to professional satisfaction were the same as our staff, and that they really needed to come together and be addressed all under the same umbrella. And so that was sort of the genesis of CHOP. And so there's three pillars to CHOP. One is professional development, one is leadership and excellence, and the third is wellness. The professional development pillar is being co-led by Dr. Boyoung Suh. I don't know how many of you have met him. Incredible medical educator, brings a lot of expertise to help us. He is co-leading that pillar with Dr. Stacy Sotovia, who currently leads up the professional development on the faculty side, but that's going to expand across the continuum. The leadership and excellence pillar is being led by Dr. John Mallinger. You think of no one better to lead that pillar. And then the wellness pillar is being led up by Dr. Christine Todd, who you all should know from medical humanities. And then we have a couple of other people working with us as well. So it's really a phenomenal team. I'm really excited about the name, because the name really represents what we're all excited about, which is potential to really improve everything here at SIU. And we are grateful to have an incredible dean who kind of shared our vision and is letting us run with it. So thank you for being here, and we'll hand it back to you.
Thank you very much, Dr. Hingle. So I think you all know that as a society, we're in an interesting place right now, and in some ways a challenging place. We've got a widening gap between the haves and have-nots, and increasingly disruptive dialogues about the pressures that places on many aspects of our society. And as you watch what's going on in healthcare, I think we've all become aware that healthcare could be a flashpoint for some of those disruptions, or it could be something that helps hold the fabric of society together. And there's been an increasing recognition in recent years about the role that physicians need to play in that discussion. That is, people that are embedded and in many ways have been responsible for a lot of how healthcare is administered and distributed. We have a critical role to play, both as patient advocates and as stewards of resources. You've all seen that already as you've started to learn about the art and science of medicine as students. And I know I would say for myself, I suspect Dr. Hingle, Dr. Kruse would say the same thing, that if there were two areas that have been very important in my life and career as a physician, since my initial education, that I learned almost nothing about in any intentional or planned way during my educational processes, they would have been education and leadership. it was sort of assumed that because you go through this long paradigm of training yourself, you know how to teach. And that's not necessarily true, and most of us find that out the hard way. And I would say the same is true of leadership skills and competencies. Many people who end up in medicine, many of you have actually developed some of those competencies from your life experiences. But having any kind of organized, intentional, purposeful mindset about how I might cultivate that was not on my radar screen as a student or as a resident. And pertinent to the issues I was just speaking about, I think a lot of our future in healthcare, but also as a society, has to do with how your generation does a better job, hopefully, of that than I think mine has done. So in the structure of CHOP, and specifically the structure of a pillar that's focused on developing leadership and patterns of excellence as an organizational habit, we wanted to start at the student level with making that an intentional conversation and creating venues and opportunities where you can be thinking about developing and having opportunities to develop your skill as leaders, so that as you enter into the workforce, hopefully you'll be equipped in a different way than we were, and that's part of what we hope to accomplish. And this interest group is our first step towards that with you as a student body. So I'll talk a little bit more at the end about where we think we might go with that in the future, and we would actually cover your ideas about that. But we'll share with you some of the thoughts we've had, and we'll be sure to keep this to an hour. I don't want to waste your time or take advantage of the time of others who've been here to help record this, so hopefully we can have Dr. Kruse's comments for our benefit in an enduring way. I want to thank Dr. Kruse also for taking his precious time to be with us. I think you all know how high a view he has of the students and the role of education and what we do as a school. There's a lot of things on his plate, but I know this is close to his heart. But I appreciate him taking the time to be with us. And I won't have a long introduction of him. I will just tell you that I first got to meet him when I came here to meet the department chair of family medicine. And I learned quickly that some of the things that group was doing around education, around patient care, around models of patient care that were patient-focused, around team-based care, were very instructive to the rest of us. And in his role as dean, I've seen him applying that mindset in a variety of ways that I think are helpful to us as an institution and really key to the future of healthcare, a primary care focus that accomplishes things based on the needs of patients and populations. Some of the initiatives he's undertaken at the school level, I think, are really creative ones that are helping us to those ends. So I think you're in a good environment to learn these kind of skills. He's the chair of the American Board of Family Medicine. At this point in time, he's involved in a lot of national leadership roles, many of which I'm sure I don't even know about. But so I want you to get a flavor that even though he's your dean, he's our dean, he's a person that's recognized nationally for his leadership skills. So I think this will be a really fruitful conversation. I also want to say one other ground rule. If you have a question you would like to interject to overcome the script that I've got, you are welcome to interrupt. In fact, that might be a better question yet. So please feel free to jump in. Dr. Kruse, I'd like to begin by just asking you to describe a little bit for us your own journey in developing leadership skills, and maybe describe a little bit about at what point in your own history or growth you started to think of this as a specific set of competencies that you might develop.
Well, I'm from your generation, so I didn't think about it very early, that's for sure. So I think most of you know that I'm from a small town in central Missouri, these 1,700 folks. And, as I was growing up, I actually didn't aspire to any leadership positions at all. So I wasn't a student council representative. I wasn't a class president. I just did my things with studying and my athletic teams and playing my trumpet and the music and all those kind of things, and didn't even think about leadership at all. You know, I will say that after I graduated from high school, though, I was the recreation director at the Salisbury City Park for 4 years. So coached like 11 baseball teams each summer, and taught tennis lessons. And it was at that time that the teaching skills, actually just the love of teaching, started to come. And 7 to 9 year olds, 10 to 12 year olds, 13 to 15 year olds, they're all a little different. And developing some skills to lead them at that point was probably the first time that any of that came to me. So again, I didn't even know that I was planning to apply to medical school until I was a junior in college. As a matter of fact, switched from engineering to chemical engineering to chemistry at that time, and then went down the road of becoming a physician. Again, not aspiring to any type of leadership positions there at all. I'll also say that along the way, even through residency program, there was just a lot of opportunity to take various personality tests and other indicators of what makes you you. And I came out at about the highest percentile possible on the introversion scale at that point. And it is true. As a matter of fact, when I interviewed for residency at the University of Missouri Family and Community Medicine, the chair of the department wrote on his evaluation of me, both he and his wife are painfully quiet. No, it's really true, as a matter of fact. No joke. But here is maybe one of the turning points. So as third-year residents in family medicine, we had to each give 2 grand rounds a year, and they were big deals. There were big preparations. You had to do the research. Everything was just supposed to be just right. You were to captivate the audience and get your message across. And so I did my second one. I had a little bit of humor that I put in there, which again was not natural for me. And one of my residency mates came up afterwards and said, "Hey Jerry, you've got this teaching stuff down, and what you said really inspires us. And that Robert Wood Johnson fellowship that they've got here after the 3rd year, you should do that." And I said, "Don, you're crazy. That's not me at all." And then the little group of 3 of us that had planned to practice, things just didn't work out. And so I actually wound up doing the Robert Wood Johnson Academic Fellowship in Family Medicine at the University of Missouri. Got a master's in public health out of that. I had no call except being on call for babies. Got to do 60 hours a month of emergency medicine at Columbia Regional Hospital. But the fellowship itself was a leadership and research fellowship. So I was there mainly to develop the research skills. I loved the statistics and the clinical epidemiology and all of these things. But all of these little leadership meetings kept creeping in too. And various leaders would instill things like Jerry Royer had a course on how to run a meeting. An important skill. And then the ethics of leadership, Jerry Perkoff, who was the fellowship director, had that one. And I remember one night at his house, he had the head of the philosophy department from the university come to his house, and the 2 of them would lead the discussion. And one night we talked about characteristics of the learned professions, law, the clergy, and medicine. And I'll never forget what was said that night because it just struck home. What are the characteristics of the learned professions, of which I was privileged to be one at this point? Well, first of all, mastery of an extensive body of knowledge. Don't underestimate how much you know when you come out of medical school. It's a lot, as a matter of fact. The second thing is the development of rock-solid confidential relationships with your clients, with your parishioners, with your patients. The third one is giving back to your profession by teaching the next generation. And I think that's a characteristic of leadership. And the fourth one is doing uncompensated care. And you know that a good portion of what you do won't be compensated to cover your expenses or compensated at all. And then the fifth one was being a leader in your community. okay, it kind of struck at that point that yes, every physician in some point needs to be a leader. And so there's a variety of ways to do that. So it was then that I started thinking about, well, how do I do that in what I do? Now, I never aspired to be a residency program director or a chair or a dean or any of those things. But, when you think about those things, it's pretty clear that doors open all over the place. And you'll have choices of many good things and many different ways to lead. And I think you'll just have to see the ones that really are for you. I'll go on a few years further. When early in my tenure as chair of the Department of Family and Community Medicine, I was at the national meeting, the Association of Departments of Family Medicine, just kind of sitting there doing my thing. And the presidential triad, the past president, the president-elect, and the president of the organization came to me and they said, "We'd like you to head our Legislative Affairs Committee." I said, "Well, I've never done advocacy before." "Well, we like the way that you package and deliver information, and our lobbyists can really help you, with the relationships." I was like, oh, there's a big piece that somebody is recognizing that part of communication. Communication really is listening and packaging things in a way that makes sense to people. That's what it is. You develop that, obviously, through all of the activities that you have, including those things that are the extracurricular activities of all sorts, your community service and everything else. But, those are the things. So Don Schnurpfeil, when he told me that after the grand rounds, and when Warren Newton spoke on behalf of those three presidents, I would say those are probably the two turning points when I really recognized that there was something to be had there.
So I learned when I proposed to my wife, say back communication techniques, because I said things so poorly she had to say back to me what she said. So I want to use that skill here. But I just heard some really profound things. I'm just going to summarize some of the things I think Dr. Kruse just said. Number one is he didn't set out planning to be a dean. And in fact, if your stereotype of a leader is the extrovert out in front of the crowd, he would not have met the stereotype. But he was reflective, he was insightful, he listened to people around him who called things out that they saw in him that he maybe didn't even perceive in himself. And listening to those things, it happened in a kind of organic way that he started to get opportunities to develop leadership skills and then pursue them. The other thing that was pretty profound that he said is that principle of your communication skill and what that can do. And there's actually a book about leadership that one of the premises of it is that the way a person gets A, recognized, and then B, given opportunities to be of influence in an organization is by communicating in an effective way and simply being recognized for being part of a good conversation. So thinking about some of the things you just shared, if you did nothing else, would be great takeaways for what we've heard so far tonight. Any questions any of you want to ask him about anything Dr. Kruse just shared?
I have a question.
Yep.
So how did you determine, so you said that multiple doors, open, and you kind of had to pick the right one. How did you figure out which ones were right for you versus which ones weren't such a good option?
Yeah, that's a good question. I will say, one of them was the career choice, whether to stay in engineering or to go to medical school. I think either one of those probably would have been good. I can't say that there was any particular process there, except that I know that the engineering that I had been through was very solitarian in a lab, and I really hadn't experienced it in the corporate world. And I do know that what I saw on my first tour of the School of Medicine at the University of Missouri was a lot of people who were interacting with each other and a lot of conversation and contact with others. I think that probably did it. The next decision was what to do as a career in medicine. And so the three things that I was thinking about were dermatology, maternal fetal medicine, and family medicine. And a lot of people looked at me and said, what? Those things are nothing alike. And it took me many years to look back on it to figure out what I was thinking at that point. But I think it was maternal fetal medicine, very high risk, very very action-oriented, some very difficult decisions that happen bang, 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 really. And dermatology, a little bit better lifestyle, but a contained body of knowledge that you can master. And then family medicine, just for me, was if I was going to do primary care, that seemed to be the primary care for me. I know that varies from person to person, but I had two really specific great role models who were third-year residents that I interacted with that really flipped the switch, on family medicine. Then, after that, choosing where you go to start your career. When I finished the Robert Wood Johnson Fellowship, it's like, okay, I do want to go to a place where I teach, but I want to go to a place where I can really get good skills as a clinician. So I want to do a lot of clinical work. Well, SIU Quincy was 4 years old at that point. They had 10 residents and 2 faculty members, 2 busy hospitals. It was like, okay, that sounds like a good one for me too. So University of Missouri, University of Cincinnati, and Medical University of South Carolina were the other 3 places that I applied. But I picked Quincy mainly because of the ability to do a lot of clinical work. And clinical work we did, as a matter of fact. It was really good. So would any one of those other 3 things have been bad? No, all 3 of them would have been great. And had I chose one of the other 3s, would things have worked out well? I think they would. And that's the position that you're going to be in. You're going to have choices among very good things, and there's going to be hair's breadth decisions sometimes.
Jerry, what you just described sounds a lot to me like somebody who leaned into the opportunities that came to them and embraced them for the learning opportunity that was there for you in it.
I think that's true, yeah.
Can you describe, alongside that, maybe other intentional practices students could engage in even at the student level of their development that would help them grow in leadership competencies?
Yeah.
Leaning into opportunity, but what else did you find along the way, or if you look back now, you said I would have cultivated this or this?
Yeah, that's a really good one when you're a leaner on the opportunities to try to really identify those things. I will just say that I really did try to respond to cues that other people gave me about that, and really tried to listen to that. I think the flip side of that is that once you assume a leadership position, that you should really try to find those people who have the talent to do the job and have the abilities to listen and to package and to set a vision and to build a team. Setting a vision, building a team, inspiring usually are things that come after you learn how to communicate and problem solve. So just keeping that in mind as well. Now, intentionally speaking, I would think that there could be nothing better than this, to have a C-HOP with a pillar for excellence in leadership, and to take advantage of the things that Dr. Mallinger and Dr. Hingle and the others are putting out there for you. There'll be a myriad of opportunities there. And then I'll just say, about, obviously there's lots of activities that you can do. And I won't delve into those, but things that you can do on your own with respect to literature and reading. We all have our own styles about that. So what I like to do is read history or historical novels. And so in particular, something that's been really great for me is Doris Kearns Goodwin, and what she's written, well, in one book about Teddy and Franklin Roosevelt, Lyndon Johnson, and then the book about Lincoln. Those have been just amazing. And then there's other historical fiction as well. And then just other things that are of interest to you. That's probably one thing that I can say. Things that just warm your heart and excite you, and things that you want to do are very important. And I'll give one example here, because I just pulled it off the shelf a couple weeks ago. Quite a number of years back, I was given a book, and I can't even remember by who, October 1964 by David Halberstam. Now, has anybody heard of that book? Okay. So David Halberstam was a writer for the New York Times, sports writer, but he wrote generally as well. And 1964 was a great turning point in sports in the United States. And one of the great turning points was the defeat of the many times champion New York Yankees by the underdog St. Louis Cardinals. Who's a Cardinal fan here? Yeah. So the Cardinals won that World Series in 7 games, and you know, I went to my first baseball game in St. Louis in 1962. So I just loved playing baseball. I loved the Cardinals. I loved Major League Baseball. Actually, I'll tell you this one. When I was in 2nd grade, one morning I was writing the National League standings on the chalkboard and writing names of dinosaurs. And the 2nd grade teacher, Georgia Mary Smith, came in and said, "Oh, look at that. Jerry can spell Tyrannosaurus, but he can't spell house." How do you like that? Anyway, I don't know what that's got to do with anything, but so Halberstam, actually, the book, the last third of the book was almost a play-by-play rendition of the 1964 series. The first 2/3 of the book were a social commentary on racially divided America. And the Yankees represented segregation, and the Cardinals represented, to a really mild degree, integration. And so Halberstam went through that step by step, developing each one of the characters that, no, weren't characters, they were real people that, you know, later made a difference. So, you know, the Cardinals had 4 African American players and 1 Hispanic player. The Yankees did have 1 African American player. But the Cardinals players, you know, one was Bill White, their first baseman, who became the president of the National League, and then, you know, wrote a book and became a New York Yankee broadcaster for 18 years. And then Bob Gibson, you know, obviously, you know, phenomenal, has become, you know, an inspirational orator. And then I'll leave Curt Flood till last. So Julian Javier was from the Dominican Republic. He and Juan Marichal were the first 2 from the Dominican Republic. But Julian Javier went back to the Dominican Republic, named a baseball academy in honor of Stan the Man Musial, and helped develop all of the baseball talent that came from the Dominican has come into the National League. And you know, the one that's my favorite one of all is Curt Flood, who was the center fielder, who challenged the reserve clause in baseball. At that time, there was no free agency, and a player was tethered to that team forever once they signed a contract. He and 3 other Cardinals were traded to the Phillies, and you know, he would have no part of that. He wrote to the commissioner wanting release and wanting to be a free agent. You know, he was actually denied that. He got death threats. He was blackballed from baseball and never played again. But he was an artist extraordinaire. His paintings are astounding. If you want to see one of them, go to the University of Missouri Library and see the 15-foot painting of Elmer Ellis, for whom the library is named, by Curt Flood. And, you know, he continued with his art, but, you know, his leadership was that he stood up for what was right. And when Andy Messersmith came along and challenged the reserve clause the second time, guess what? It was struck down, and things were different for baseball players for all time there. The other piece of this, though, is Augie Busch, the owner of the Cardinals. This is Augie Busch III. So White and Gibson and Flood and Javier, you know, were all sitting at the hotel in spring training in St. Petersburg, Florida. And Augie Busch came in the hotel and says, you guys have your room key yet? And they said, oh, no, Mr. Busch. They told us our hotel is 3 miles over that way and that we'd have to walk there. We got our bags and we're ready to go. What? You guys sit right there. About 20 minutes later, he came back and he says, you're each getting your own room. And he had a room key for each one of them. And Bob Gibson said, how'd you do that? I said, I bought the hotel. Well, I mean, he took a stand. Anyway, you know, that's a lot of that. But that book, you know, just, there's all little things. That book meant so much to me about how a lot of people who didn't have the privilege that I did, you know, stood up and made difference as leaders in what they did and helped change society, you know, at that point. So anyway, I thought that was just a good leadership book that never gets on the list for leadership books, you know.
Those are profound examples, and it brings up something I had wanted to get you to talk about, and you've already jumped into, is I think a lot of times we think of leadership as a title, as a job category. You obviously weren't born with a dean's robe on your shoulders, but that's what you've grown into. You didn't do it by setting that goal and saying, that's what I want to be someday, but by doing these things more organically as it came to you. And the examples you give are people who didn't necessarily get titles and maybe even didn't see that they were successful in what they pursued, at least in the Kirk Plug example directly, but somebody else benefited from their willingness to invest. So I was going to ask you to comment on things you've learned from leading when you're not the leader, leading from the second chair, being of influence for good in settings where you didn't necessarily have the title. Could you make some comments about that?
You know, I will. And, you know, I think the best way, there are two things I'd say to that, and I've mentioned both of them before. The first thing that you can always do is put information together in an understandable way and use that to help influence the decisions of others or help, you know, lead other people along. You know, there's a lot of information that's hard to read and is not packaged, even though it might be based on evidence. And it is just crying to be put together and to be put out there. And then the other thing is, you can always help and support people in moving forward a vision and helping to inspire other people to go with that vision as well. So, you know, I will say that, you know, I have clearly learned that, you know, having a very specific vision and some strategies and living by those things, and then trying to determine the strategies that other people really might have and how those fit together. You don't have to be the one that's leading to do that. You can get that information and give that to someone else. And that's just part of being the team. And you know, every leader needs to put that team together and have those folks that are supporting, well, in my role, you know, supporting me to do those things. And you know, it's very, very important to have people who say no or watch out, or you know, I don't like the way you're going here. You know, if you don't have someone like that, I don't think you'll really be a very effective leader. And if along the way you have to play that role to actually help another leader move an organization forward, I think, you know, that's really important too.
That's great. So one little summary you gave a little bit ago is you talked about different steps and ways you can be of influence. Communicate well, problem solve, set vision, inspire others about vision, and form good teams.
Yep.
I think you covered most of the curricular content just in those statements. What have you learned from failure in your journey as a leader? If I'm a student, I'm sitting here, a faculty member, or any of us, there's times where you feel like you've totally flopped on something you really wanted to succeed at. Has that ever happened to you, and what did you learn from it?
Yeah. Well, you know, yeah, it has. And so there were a couple things, you know, early in my days in central administration, you know, in 2013 and 14, which I kind of jumped in a little bit too quickly without doing the things that I just said to you, you know, understanding other people's real strategies and real mission. Those kind of things, you know, really make me feel bad and down and almost like quitting, as a matter of fact. And at night, they make me lay awake, and the bruxism really gets going. You know, the teeth grind, and the dentist said, "Here's a mouthpiece that you need," you know, and all those kind of things. You know, those things will occur. There is no doubt about that. Again, I think it's the team you put together that actually, you know, pulls you back up. I'm not the best one for being determined and just fighting right back. You know, I have to be encouraged to do that. So I have to have some people around me. I will tell you, I have learned, though, that learned a little bit about actually, coming right back when things are not the best. But, I've learned to reflect on it. I've learned to talk to the people around me about, what really went wrong. I don't know if it's exactly a root cause analysis, but, it's at least reflecting and discussing what's going on and, relying on them to do, the people close to me, to give some analysis, some realistic analysis about what the issue was. I don't think I should go into the specific issues right now. It's not exactly the right time to do that.
That's really good, though, that having a growth mindset when something doesn't go well, what can I learn from this? What can I get out of it? How can I do better in the future? And having a community of people around you, so that probably has helped keep you humble in success and also encouraged when you would otherwise maybe lose your energy.
That is true. At one of the Association for Departments Family Medicine meeting, they had a give and take between one of the chairs and the assistant to the chair, or the administrator of the department. And they had a little conversation that went back and forth. It was actually lighthearted, kind of funny. But then at the end, they really brought it together, and the chair said, "I want to do the right thing," and the administrator says, "I want you to do things right." It's like, yes, it's that dynamic to do really have the vision to do the right thing, but then to do it in the right manner, which really gets the job done, I think.
Very good. So we know you're very busy. I suspect every student feels busy in ways that they hadn't even found possible before they entered med school, and we're trying to devour this knowledge base that now doubles, they say, every 18 months, I think is the latest statistic. And yet, when I listen to you tonight, there's a joy as you talk about these things. You're not burnt out.
No, I don't think so.
So in the
Sometimes I feel that way, burned up.
So in the busyness of your life as a dean with so many people to be accountable to, how do you lead yourself in things like time management and personal growth? So I'm a student sitting here and I'm like trying to figure out how I possibly balance all these things that I'm trying to juggle.
Yeah.
How have you learned to do that?
Well, a couple things. So I've actually been intentional about trying to be efficient and stick to things I'm doing so it doesn't prolong things too much. I'm a morning person, so you might often see me here at 6:15. I get in here and I like to do work in the morning, but poop, when the late afternoon comes, like about now, I about run out of gas. And, I learned this from my chair at family medicine. When I became the chair in family medicine here, he called me and said, "Hey, could you drive down to Columbia? I'd like to talk to you." I said, "Okay." So I went down there and, he gave me some advice about how to have holes in my schedule so that, I could actually think about things and do things. You'll see some CEOs, particularly hospital CEOs in this area, that just pack their schedule for 12 or 14 hours a day, and you can't get an appointment with them for 6 months. But then there are those that make sure that they have 2 or 3 hours completely open every day so that they can respond to things that are occurring. I think they're the better leaders, to tell you the truth. So, I have a very intentional way of, setting that calendar so there are gaps and those things can occur. And I think everybody develops their own special one. And then, the other thing is I don't work 80 or 100 hours a week. I mean, I just couldn't do it, quite frankly. So, I do try to look out there and set the time for the vacations. And let me tell you, I can turn it off. When I leave and I'm gone for 10 days or so or something like that, I can just completely not think about what's going on at work. Even when I take those 2 days to clean my email up, because nobody cannot do email for 10 days. That's impossible, don't you think? Anyway, and then just putting some enjoyable things in there with people you like and enjoying. I tend to enjoy the solitude as well because I'm still in. Oh, I will just say this: when I was 43 and became chair of the department, I went through another battery of those tests when I went to the double AMC chairs boot camp, and like on 2 of them, they had my scores from the past. Believe it or not, there must be some kind of data bank. But they said, "We've never seen anybody who's moved so far from the introvert to the extrovert scale. Did you cheat? And no, I didn't cheat. I'm just telling you my heart, as a matter of fact. No, I don't know what happened there. I don't know. I diverse.
It wasn't electroshock therapy or anything.
Not that I recall. Maybe TMS, who knows?
Well, those are pretty profound things too. So I think I heard you say that one thing was having some self-insight about your strengths and limitations and not trying to exceed those. It sounds like you learned to build margin into your day to allow you to deal with things that were going to come up,
Yeah.
but you prepared intentionally for those. And then you also discerned what the restoring activities for you were, like solitude. And I've often seen that with students and learners that do well. There are certain things in their lives, certain disciplines, might be athletic, might be relational, might be spiritual, but they don't abandon those things when they get busy. They preserve them, and it's part of what keeps them whole and sort of in the rhythm of an effective pattern of living. So that's very helpful. Let me ask you two more questions, and then we'll wind down unless the students have some more. One was, I was just going to say, if you were to think back over your own development and growth and influence, what do you think the fundamental character qualities of somebody who wants to be a good influence we talk about it as a leader, but just people that will be influential in constructive ways, what character qualities do you think we need to think about?
I think the first one are those who put others' interests first above their own. Now, you've got to balance that out in a really, really good way, but when you think of leading an organization, you have to put the organization's well-being right at the top, at least in that part of your life when you're doing that as well. I would just say, the other ones we've talked a little bit about before. That ability to solve problems and being efficient in doing that. Kind of having a focus for doing that in a way so that you can support what other people need. And then again, I would say the very biggest part of communication is listening. So I think you have to be a listener, and you have to be able to analyze what you've heard, probably intentionally doing that. And I think that one is a little bit of a hard one. I think we all need to actually pay more attention to actively listening.
So I was in a coaching course last month, and the lady teaching the course made the point that she said there's a lot of people in the world today who go through their whole day and never have somebody give them their undivided attention. And it's actually quite a transforming experience, and that was her pitch that for coaching, but it could be for life, that become a really good active listener, and you'll be going about your day doing things for people all day long simply by giving them that kind of attention in the world where people don't get that much. Any questions any of you guys would like to ask Dr. Kruse that we've not been able to get him to touch on?
I guess I have one. In terms of being like a political advocate for your patients, considering the current political, very polarized situation we're in, what kind of advice do you have for students who are looking to kind of build that voice, but you don't know where to start?
That is an interesting one because, I went down the road again with that position with the Association of Departments of Family Medicine. And, it was just really amazing to get the connections that the lobbyists had, but to, use the material that I had to try to influence them. Now, that's advocacy on a macro level. How do we influence the healthcare system so that we get better population health outcomes at lower cost? That's much more of a macro issue than some of the very specific things for patient advocacy. But I will just say this, that once you get that information and you know what you want to say and you know what's important, then just getting to know health policy advisors and health staffers for either state officials or federal officials, they always want to hear what you've got to say. And they want to hear students more than they want to hear me. And there is no question about that. You know, I've really experienced that in a lot of meetings. And, you know, if you provide them the information, provide them the contact information, you know, do some follow-up, you know that you've made your mark when you get the call. Hi, Jerry. This is Myra Alvarez from Senator Durbin's office. I just wanted to ask your opinion about the wording in this bill. Oh, you know, driving down the road, well, Myra, I would say this, boom, boom. And so then they make the change and then it gets in the bill. It's like, okay, you've become a trusted advisor. And that's easier to do than you think. You know, it's a matter of making the contact, taking some information, showing that you understand what they need and what they want, and getting across the point that you want. And you'll build yourself as an expert to them pretty quickly. And that's the way to have influence, is first to get the health policy advisors, and then they get you the access to the senator and the representative, and write some things, package them up.
Great question. Anybody else?
I was just wondering, kind of on the flip side of that, you talked a lot about like packaging information well, like being able to communicate it that way. What do you do when you feel like you've really like packaged something well, presented it well, and then it still kind of gets dismissed?
Oh, it does all the time. And so you just forget it and you keep doing it. And finally it will catch on. So, you know, I will say that there are several advisors of a president, as a matter of fact, and it was just impossible, you know, to get anything across. And it was so frustrating. And then another president came along, and it was so easy to get things across, and it was so joyous. So I would just say, you know, you just keep with it. You know, some things are going to go nowhere. I mean, they just are. And don't worry about it. You haven't wasted your time. You know, you've packaged the information. It's ready for the next go around. Yeah. And you know, when you get to the point that you have this information and you write it so it sounds like an op-ed, and with a table, one table, and an op-ed, that's what they like to see. So work on your editorial skills. Maybe, you know, send some letters to the editor, or write an op-ed. You know, 600 words. That's it. That's what op-eds are, 600 words. Anyway, you know, I would also say this. I mean, so the students at SIU are astounding leaders. I mean, you do what the students have done who graduated from here, and from what I've seen from all of you, just astounding. You know, and we really hope that CHOP will really move that forward and really make that, you know, easier for you to get to that point. But I'm just saying, I like to sit back and watch and see what happens. It's fun.
There's a book I just read. Maybe we'll think about doing together as we go through this. I talked a little bit to Sue and Jerry about it, called Reverse Innovation in Healthcare.
Oh, yeah.
Have you read this or heard of it? Without spending way too much time, it's a book about exemplars from India, about how to work in a setting without the resource stream we have and do really high quality health care. So I'll give you one model. There's a cardiac surgeon there who had gone to the UK, got trained at Guy's Hospital in London, extremely well trained cardiac surgeon. He was attracted back to India by somebody who knew they needed a higher quality cardiac surgery provider. Wooed him back, but when he got there, he looked at the needs around him and he said, whatever I do in India, it's got to take care of the poor, because that's an overwhelming need here. And he came up with a system whereby, by caring for free for those who can't afford their care, and even about thinking of ways to pull them into the system that otherwise they couldn't access, they would generate volumes of work that would make their cardiac surgeons technically the best, because they were doing so much surgery. And that attracted the people that could pay, and that created an entrepreneurial model that allowed them to continue the business. So that organization started on that premise. I think we could learn some things from that in the U.S., right? Now does more open hearts than the Cleveland Clinic and the Mayo Clinic. It has lower mortalities than the Cleveland Clinic and the Mayo Clinic, and is opening a hospital in the Cayman Islands, an hour plane ride from Miami, and the hopes of bringing that idea into the Western Hemisphere and maybe even challenging American healthcare. So people like your generation coming up with ideas that aren't in the molds that my generation has followed about third-party payers and the whole structure of American healthcare that's kept us from solving some of these equations that we need to solve. Again, if medicine is going to pull our society together, we need your generation to lead. So if that's come across in some of the things and some ideas about how you might go about that, what Dr. Kruse has shared tonight, that's been very helpful to us. Thank you, Dr. Kruse, for the time that you gave us tonight and for those insights. And I'll just say in closing, because I want to honor your time, where we think we'd like to go with this is a couple things. And one is to maybe once a month or so do something like this. We might use, and we're going to use this strategy in different segments of the organization, but certainly with the student body as people are interested, work through a book together, a simple book, not some big tome that had all the things you already are trying to do, but a book you could read a chapter in 10 or 15 minutes, but is really well written on the subject of leadership. We have one picked out that I think would be good. And once a month, get together and talk about the ideas it presented, talk about how you might apply them even in the phase of your development that you're in now, and start to develop an organizational language around these themes, a lot of which are things that Dr. Kruse talked about tonight. And then if that resonates and there's a group of you that feel like it's really helping you, our other thought was to use something like the pipeline program. And actually, you're familiar with the concept of praxis, that some things you learn best by doing them, by how way that we'd be supporting and helping you going out into those schools and you teaching some high school students what you're learning about what it means to develop leadership skills, and maybe even starting to affect our community outside the halls of the School of Medicine, with you being the leaders that are helping you train others. So if that sounds good, we'll send out some announcements and do something like this again about on a monthly basis. And we would covet and welcome ideas from you about what might make it more meaningful, effective, and helpful. Any final questions for Dr. Kruse? If not, I think Dr. Hingle almost wore out her biceps carrying 10 pizza boxes over here, so please take pizza with you. And thank you very much.